Hello, everyone. We're really excited today to talk a little bit about our proposal on vaccine equity. To start, my name is Justin Joseph. I'm an undergraduate researcher here at Emory University studying economics and human health.
Hi, my name is Rajat Thegde. I'm an undergraduate researcher studying economics at the Oxford College of Emory University.
Hi, my name is Emma Perez. I'm also an undergraduate researcher at Emory, and I'm studying neuroscience and comparative literature.
To start, we want to tell you a little bit about who we are. We are researchers under the direction of Dr. Shilpa Krishnan at Emory School of Medicine in the Department of Rehabilitation Medicine in the Division of Physical Therapy. Through our research efforts, we've been able to partner with community leaders, and specifically, we co-lead the only Atlanta-based stroke and traumatic brain injury support group, Young and the Restless, or YNR for short. Today, later on, you'll hear a little bit from community leaders, Roger and Kelly, who are also on the board of the Brain Injury Association of Georgia.
For a little background on our project, as the pandemic is coming to an end with the help of the vaccine, it's important to acknowledge larger issues associated with vaccine equity. There are many disparities in vaccinations numbers on racial, economic, and social lines, and these disparities have prolonged and exacerbated the effects of the virus. Factors like structural racism, politicization in the healthcare system, and an overload of information have led to growing mistrust when it comes to fair and equal vaccine distribution. The CDC recommends clear, transparent, and consistent information that addresses specific misinformation and vaccine side effects, risk, and promotes the benefits of immunizations.
So our idea is to make a space where the disability community can ask questions about the vaccine within a more natural setting. So we're looking at support groups. This is a unique setting because it bridges the gap between professional and personal. As facilitators of the Young and Restless Stroke and TBI Support Group of Atlanta, YNR for short, ourselves, we've seen the importance of building trust within a community. Every support group is different, but in YNR, we invite members of local professional and medical communities who are trusted by the support group leadership to share knowledge and answer questions. Our proposal would be similarly structured. We'd start with some of the most frequently asked questions from the particular community about the vaccine. For example, in YNR, a stroke support group, we would talk about how stroke changed the immune system, the risks of the vaccine specifically for stroke survivors, and everyone's favorite, how was the vaccine made so quickly? In other support groups, we'd shift the focus from stroke to other conditions. Ultimately, we'd want to be a resource for answers based on research to aid in decision-making, but we'd emphasize each individual's ability to make whatever decision is right for them.
A central tenet of our proposal is to be guided by facts, but more importantly, allow for discussion and conversation. We want our discussions with community leaders, our neighbors, and community members to be a place for information, to be a place to ask their questions. We've heard from the community the onslaught and overstimulation from the media of different sources and an inability to discern what's true and what's specific to them. As a result, we hope to have discussions that they can relate to, understand in layman terms, and just be able to ask questions they've always wanted to, but giving them answers that are guided by facts and from our research. Some of the questions we've actually heard from our community members are, how are vaccines created so quickly? Are they safe? Should I get a vaccine if I've had a stroke? And we kind of just want to provide that information in an easy and digestible way to understand. We want to show how mRNA vaccines are nothing new. We actually have seen them through the flu or other diseases such as the Middle Eastern Respiratory Syndrome or SARS in 2002 and 2012. Are vaccines safe? Absolutely they are. It's safer to get the vaccine, and the risk to benefit ratio in terms of getting COVID versus the vaccine is ginormous. It's safe to get the vaccines because actually COVID-19 actually increases one's risk for stroke. It causes blood clots. In addition, should I get the vaccine if I had stroke? Yes. Individuals who've experienced a stroke are a vulnerable population, and as a result, getting their vaccine helps our community be healthier. We not only want to tell these facts, but we want to have a discussion. We want to share our knowledge, conversate, because that's how we think real change occurs.
So in order for this proposal to be feasible, we would definitely meet with the leaders of the support groups several weeks before our visit. The community leaders have the best knowledge of how to engage the support group member. They can help us shape our visit to the support group style, in person, virtual, etc. These relationships would be vital, and we'd mold the information that we present to the particular concerns of the group as communicated to us by their leaders. We wanted to show you how this would work, so we invited two YNR leaders, both survivors themselves, to take part in this proposal. So for the next few minutes, we'll share conversations that we had with them and their thoughts about our ideas.
Here we are with Roger and Kelly, who are community leaders with the Young and Restless Stroke Support Group. Roger and Kelly, would you like to introduce yourselves?
Hey, I'm Roger. I'm the co-leader of the Young and Restless Support Group. I had a stroke two times. and I look forward to talking with you today.
And my name is Kelly, and I am a survivor of a stroke when I was 40 from a rare genetic disorder, and I'm on the leadership team. And Roger and I both serve on the Brain Injury Association of Georgia's Board of Directors.
Great. So to start off, maybe tell us a little bit about Y&R. I know y'all have speakers coming, so that's like why we're here. So what's the purpose of having speakers in the group? That's a little bit different than maybe some other support groups. And be like, how do the members interact, or how have members reacted to having speakers?
I learned that it was a safe place that you can talk and tell about your feelings or tell about your issue that was related to trauma. I found the stroke support groups as a great place to find people that were just like me. But one thing I wanted to do with this support group, I also wanted to bring in speakers to talk about topics that were relative to stroke survivors, to bring a certain balance of understanding what's available in the society that they can use to either adopt to current things or accommodate for current areas that a survivor does not have.
To kind of progress, let's talk about vaccines. Let's be honest, vaccines can be a really contentious subject, all the way from political perspectives to historical context to personal ideologies. Have you guys talked about vaccines yet in your support groups? Why or why not?
Talking about vaccines brings up so many issues that could not be broken down in our meetings. So I decided not to address those.
Since you guys are community leaders that are trusted and you guys have influence in your support groups, what are ways that you think would be effective to bring up vaccines, even though it's a contentious topic? And we want to ask you this question because we want to create an individualized presentation that speaks to the members of your group.
For me personally, as the research is coming out of long COVID and the COVID's effect on the brain and the severe fatigue, one of the pushbacks we get a lot is, well, this is a disease that 98% of the people who get it, they live. And I think my heart has always been, just because you live doesn't mean that you survive. You can end up with the long COVID, you can end up with brain injury, you can end up with the fatigue. And as a survivor, we know what it feels like to live that way. So one way to say, hey, let's talk about vaccines is, hey, let's talk about keeping our friends and our family from having to walk the path we're walking. So we're very careful. There's a lot of our members that simply cannot get this vaccine. They can't get any vaccines. But for those that can, we want to bring the perspective of how do you keep others from having to go through the same symptoms that we talk about monthly that we all struggle with.
Well, so I have a little bit different view. In my view, we have been in this 2-year experiment of where we're going. We don't have the history with this vaccine in the news, and it called on because news was changing by the minute. So for me personally, I relied on my healthcare provider, actually my doctor, to really explain to me what were the benefits of the vaccines and how does this affect me and how does this affect me and my current medical condition.
I'm going to add to that, though. I think for, especially in Roger's situation, our group members trust him. And so when we know that people are more apt to do something when they see somebody they trust. And when they trust that Roger said, I've done my research by going to somebody I trusted, going to my doctor. And it was after I talked to my doctor, I made that decision. I think our group members will be more apt then to reach out to their own medical professionals. And we're not claiming to be experts. We're just simply saying, this is what we did. Maybe you need to consider talking to somebody.
I think that's so interesting, and that, I think support groups are built on interpersonal relationships that are created that kind of allows information and allows kind of shared decision making a little bit. I think that's really, really powerful. We don't want to sell vaccines nor tell people you have to get vaccines, but rather create an environment for these type of discussions to occur, where Roger and Kelly can tell their stories, and we just want to provide facts, be there as just a sounding board, and that's kind of something we're really looking forward to doing. So in closing, do you think having community discussions like this would, first of all, be beneficial to your members, help decrease any mistrust, but really just open the door to conversation that allows you all to just kind of continue talking? Would this be something you're interested in?
I think it would be helpful, but knowing that you won't necessarily convince everyone. There will be one in the group that still won't take the vaccine, still does not believe what I am saying. Although there are many people that would be influenced by me telling my story, there is hard factual and disagreements out there that are still adamant or still ongoing in our society. You know, it's just not top of the news right now, but it's a very contentious topic. And I applaud you guys for undertaking this.
Support groups do provide a safe place for that conversation to start. But maybe we can start building those bridges between these contentious camps by using support groups. And maybe that's really what our purpose for these conversations are for.
Beautifully put. Yes, so thank you so much for taking your time to be a part of our project. We really appreciate it. And we're so glad that we get to actually interact with, you know, just people, real people in the community, not researchers or students or doctors, even though that's great. I think there's something really special and important about talking to other people, not within your own organization. So yes, thank you so much.
Welcome.